So welcome everybody to OktoberINVEStfest. This is our 11th annual German Bavarian American Investors and Partnering Conference. We've done this 10 times already in New York, and now we're doing it the first time in Cambridge and here at the Venture Cafe. Thank you so much to the Venture Cafe team. Whether you're an innovator looking for capital or you're an investor looking to find interesting opportunities to invest in, or you're just somebody that's looking to increase your network in for the German companies, the network in Boston and the network in Massachusetts, and for everyone else that's here from maybe the local community, if you're looking to increase your network in Germany and Europe, I think you're going to walk away tonight happy. Well, because you're going to have beer tasting and all that stuff, you're going to be happy. But just because I think you're going to meet some interesting people. We brought 20-some people from Bavaria, Germany here. They're here to meet you. I am Jan. I'm from the Bavarian US Offices for Economic Development. Bavaria is Germany's largest state with capital city Munich, in case you don't know that. And we help companies from the US that are looking to expand to Europe, and we help Bavarian companies that are looking to expand to the US. So I'd like to introduce now our panel.
Thank you so much for this opportunity. So thrilled to be here. So I'm Mridul Robinson. I'm the Chief Operating Officer of an organization called MassMEDIC. If you're local, you've probably heard of the organization. We are a 26-year-old trade association. So we represent the interests of medical device companies throughout the world, but especially here in New England. I'm thrilled to be working with our member companies from the two-person startups of the world all the way through the Boston Scientifics and Medtronics. So they work with us. They tell us what their issues are, and then we go to try to fix them. It's a very fun job. And I've also brought quite a few of my American-based and a few international startups with me here tonight, so make sure to go over and say hi to them too. We're very excited to be here. This is going to be an incredible panel. I want to give each one of my panelists a chance to introduce themselves briefly. Then we have a couple topics inside the topic of digital health that we want to center on, but we do want this to be incredibly interactive. So please feel free to interrupt at any time. I've told them to feel free to have a discussion, but if they go too long, I will hook them off the stage. So why don't we go ahead and start with Joerg. Why don't you everyone give a little bit of your background and who you are.
Perfect. I'm closest to you, so I'm afraid now that
I have a pretty good left hook.
That's
why I'm sitting over here.
They heard talk.
So I'm Joerg. I'm from Bavaria, as you might see. And I studied computer science, did a PhD in medical computer science about 20 years ago, and started right after university a company, but in medical device industry called Surgikai, making intraoperative nuclear medicine imaging, tumor imaging in the OR to precisely localize and to remove the tumor, a surgical guidance tool. I was running that for 10 years. Then I was at a medical robotics company, mainly creating a joint venture with US corporates. So it was more in kind of the licensing space of a technology. We were an engineering company, and since 3.5 years, almost 4 years, I work for a subsidiary of the Bavarian Ministry of Economics, translating innovation from science to the market space with a lot of partner organization. And that's exactly what I have to do. So talk to people, look good in a Bavarian dress, and drink beer. That's also
That sounds great,
what my duty is tonight.
I want your job.
Right. I think we all do after that statement.
So my name is Marc Feilerman. I'm managing partner of an organization called German Entrepreneurship, which runs a Healthtech Life Sciences accelerator that I look after. Called German Accelerator, and basically we help German and European startups come to the United States and de-risk and grow and scale internationally. We are in the other CIC building, just across the way. Actually, no, this is 245. So we're in this. So let's see. I'm an engineer by training. Spent 30 plus years in health tech, life science, mostly in imaging, actually. But I have co-founded, so I quit about 13 years ago, and co-founded two startups, one in nuclear imaging actually, and the other in home tech, trying to keep the elderly at home longer, which is always a good thing. And then did translational research and commercialization at Mass General Brigham for a couple of years, did similar things at Children's Hospital in Boston. And as I said, for the past 4 years, I've been looking after this program here. So welcome, everybody.
Yeah, my name is Mridul. I was born in kind of, the natural competitor of Bavaria in Berlin. And then, I moved unintentionally because it was too small to south of Germany, to Heidelberg, Mannheim, where I grew up and studied medicine. I'm a medical oncologist by training. Never intended to be a founder and entrepreneur, actually. I came to the US. Actually, I almost ended up in Bavaria because I did my training in Ulm and, almost daily walked through Neu-Ulm, which is in Bavaria, as you know. So, yeah, so I was always very close to Bavaria, but never made it. So this is kind of nice, to be as close as possible. I came to Boston in 2018, worked at the Dana-Farber Cancer Institute, with an interest in leukemia and hematologic malignancies at the Broad Institute of MIT and Harvard. So spent a couple of years in research in medicine here in Boston. And yeah, in that time, also not on my radar, I founded a company which is based in Germany, which is, very much in the cancer area, helping cancer patients to find and access clinical trials. And we are currently the largest clinical trials matching platform in the German-speaking countries and Europe, and are in the verge of expanding to the US. So I've also the privilege to work with Marc very frequently. I think this is the third time this week we're seeing each other. So yeah, always good to be with you. And yeah, I'll pass
Same
it.
here.
Yeah, same to,
All connected.
yeah, I'll pass it to Charlie. So yeah, very happy to be here with you.
Charlie Cameron. I have at least 3 hats. The first hat is I have something called the Hub Angel Investment Fund. We're on our 7th fund in the past 20 years. We do early stage technology and life science companies, mostly here in New England. For 15 years, I worked with a big law firm called Cooley, and I was like an investment bank in a law firm. I did a lot of connections with VC and private equity for our clients and also with strategy. During that time, from about 2008 onward, I was going to Germany 2 to 5 times a year and working with startups, trying to build bridges, trying to get over these cultural issues, get capital flows. Worked with Marc a lot and worked with his accelerator since 2015. It's been here in Cambridge. I was over in Germany 2 weeks ago. I'm going in another 2 weeks for another 2 weeks. So trying to sort of the comeback tour after COVID to see folks, to try to get these bridges rebuilt. Great technology in Germany, great people, great organizations to support, smaller amounts of capital to scale. So a lot of early stage capital, but not a lot of scaling capital. And so I deal with a lot of companies that are coming to the States, especially to Boston and Cambridge, for personnel, for capital, or for markets and exits. So that's who I am.
Awesome. So as we said, we'd really like this to be interactive, but also forgive my notes because I'm way older than I look, and things are getting a little bit scary. But the kind of topics that we would like to focus on in general, and if these don't match with what you would like to hear, please chime in and ask for something else. We want to talk about how to make a successful business case in digital health, talking about scalability, reimbursement, finance, and then a little bit about the data issue. So those are kind of the topics that we've got on our questionnaire at this moment we're going to dive into. But again, please raise your hand if you'd like to talk about anything else. Panel's very open to it. So I'd like to start first then with that conversation around building your business case in digital health. And perhaps we can start with you because you're so much better dressed than the rest of us. What do you think are some of the basics for a successful business plan in digital health?
Someone has to help me to return that compliment.
I may have the best hair, but
No, I think it's all about having the right business model for what you're going to do. And I think that the gentleman's left of my side can way better explain it, how it fits to the US market. I might be a bit more familiar how it fits to the German market. But I think that already describes a bit the challenge that we have. Normally, a solution fits to one market first. And you have to look that you have a business model that fits to multiple markets and can scale at the end. You first have to master one market. But if you have a solution that you also can translate then to other markets, then work with professionals, how you have to pivot, how you have to adapt it slightly, that it also fit to another market. That's exactly what you have to do. And that's in a business model always goes from the side of the market needs. That's at least my, not sure you can start a discussion and fight against me, but it's always looking at the needs of the market and then seeing how the technology fits in the market. Of course, there's a lot of technology push, especially if you come from a research setup, and that's also how I started my first company, from a research setup. Need technology, good publication, and then we tried to push it on market, and we failed. So that's why I'm a strong convincer. It doesn't work pushing the technology from the personal experience, but you should look at the market need and then creating the business model around it. First, mastering in your home market, and then scaling to other markets. Unless another market has a disease that you tackle that doesn't exist in your home market or where you are, or it has some other things there that you don't have. And we have a good reimbursement for digital applications in Germany. I might highlight a bit on that later.
I would second this in terms of, I think, validating, the problem is kind of one of the most important, I think, factors to start off a company. And personally, I can just tell, so it took me kind of 10 years to realize the problem was true. So I started, the problem we tried to solve as a company is something I would never thought of if I wasn't a physician, because it was something I was seeing every day. And it's actually not something only I'm seeing every day. It's kind of, a patient is in front of an oncologist and asking the oncologist, well, what options do I have, right? It's a very kind of open and common question. And I realized, working in Germany, I thought, I can only name the options I have as a clinician in my hospital, but nothing left and right of it. So talking about clinical trials. And then I, worked in different hospitals in Germany, somehow, noticed that this was kind of a problem everywhere. I thought, oh, maybe this is a regional, maybe this is a German problem. Came to the US, to Dana-Farber, and we have like 5 hospitals in the city within 15 minutes of bicycling. I don't have a car. So and realized, wow, this problem is actually very much the same here. It's a very different healthcare system, but still the patient need is actually very much the same. And so just kind of to just echo what you said, Joerg, validating the problem is something I felt is very important. And then it took, kind of the leap of faith to transition into this entrepreneurial role. And so we started in Germany, actually based in the US, which is also a little bit of a crazy thing. And kind of trying to master this market first, and then expand it to other German-speaking countries like Austria and Switzerland, and now the Benelux countries. So yeah, that's kind of, just building upon what you say, and I agree to that. I would like to discuss later about DIGA. I'm less convinced that, although this is a great way to, structure reimbursement for digital solutions, I'm still less convinced this is kind of, the best tool to get things on the road and into clinical practice. But we can talk about that later.
Depends. If you have a hammer, everything looks like a nail, right? But it's not a solution for all digital applications. I agree on that, but for some.
Yeah, that's true.
So if I can make a comment first, Charlie?
Please, yeah.
So I'd like to kind of riff off a couple of things that you said. So it is alarmingly prevalent how much startups misunderstand the problem that they are actually trying to solve. And it seems so simple, stupid, but we miss it all the time. And the consequences of that are dramatic and manifest everywhere. Most sort of apparently in front of investors like Charlie, who ask pointed questions to which a responsive is not a good answer. This manifests particularly visibly in digital health where there is often a misalignment between who benefits and who pays. So I align up 1,000% on understanding the problem, which is inextricably linked to the value proposition, which is all tied into the business model. And that is particularly difficult in digital health, where the patient, it's the patient, yeah, but the patient doesn't pay in most business models except for a direct to consumer. So we spend a lot of time working with German companies and actually other companies as well in the United States about trying to get that alignment down. There is no DICA or DIPA here at all. And there are some noticeable big flameouts in the digital health or implosions. They weren't even flameouts, they were massive implosions, right? In the digital health space, so that the appetite is, let's just say the gap between the promise and the reality is going in the wrong direction, if you look at it in some ways. So problem, tied to value proposition, alignment with business model, alignment between who buys and who benefits, all things that you said that I see. Charlie?
So that's all true. And I think that sets us up for a case study. So Pear Therapeutics, you may have heard of this. It was a digital health company. It was prescription digital therapies, I guess, PDT. And they had $400 million invested in the company. They had 3 products. One was for sleep, one was for drug abuse, and one was for pain. Went to FDA, all got approved. Spectacular growth in the company. Went public in June of 2021. 400 million invested, went public at 1.6 billion. So 22 months later, they're bankrupt. What happened? Well, three things. One is the primary healthcare system here is broken, very broken. The docs are not connected and the nurses are doing something different and the healthcare systems use different data analysis. They are not connected. The docs don't know what's approved by different insurance companies, so it's very hard. Another was the cost. They charged, I think, $1,400 for 3 months. People didn't want to pay that. And the insurance company said, interesting, it's all been approved, but I'm not going to pay. And so 1.6 billion is gone in 22 months. And that was the poster child of a very successful digital health company. Backing by big VCs, FDA approved, ready to go, big demand. It worked. These 3 things really worked. Bankrupt. And that's in this country. So this is not like just people trying to figure out the system. This is people in the system, VC backed. So that happened in April of this year, and that put a chill in the whole digital health area. And then combined with the fact that during Zoom periods of COVID, everyone, if you had a lesion on your arm, you could take a picture to take a look at it. Now they say, okay, we'll do that, but you still better come in. So there's been sort of a step down in the telemedicine aspect of what's gone on. Yet it's gone up for mental health. There's a lot of mental health issues, especially around COVID. People are isolated, can't get back to work. And a lot of big companies sponsor it. So when the firm I worked with, that was part of what we could get. They have 5 or 6 different offerings there from coaching and psychiatrists and all kinds of things. So if you get big companies or someone paying for it, everybody likes it. But it's a case in this country, it's very, very hard because you can have everything lined up and people want something and it's FDA approved and you have the money. But suddenly the insurance companies say, we're not going to pay. And it went under.
So the only comment I might make there, and again, I'm not going to fight over it, but there is a distinction though between digital therapeutics and digital health. So, when I heard about Pear and they were actually members of ours, we knew them very well, and folks like Achille, right, who were having some of the same issues, the digital therapeutic side is not quite, it's approved, everyone's saying, yay, great, this is happening. That's having, I think, a bigger struggle than the digital health side itself. So do you see a distinction really between those? Is that, as you say, kind of souring the market for other digital health companies that aren't necessarily digital therapeutic? I'd love your thoughts on that.
So if I could just say one thing. So I think as we say, like life science, like what's life science? Digital health, it's therapeutics, it's medtech, it's biotech, it's animals. And so you say health, digital. And people combine all kinds of things in there. So I think it's a real mishmash. There's no fine line distinction between and among them, but it did cast a cold shadow, I think, on the whole area. And now people are trying to figure out, geez, who's going to really pay for this? How is it going to be paid for? And then the other side, you have private companies coming in. So I was just reading that Walmart is coming in. They're going to give free digital primary health care to all their employees. And they're testing it out in some pilots. CVS and Walgreens moving big time into the health centers, into digital support, which is a totally separate initiative. So I think it's very fractionated, I guess is the term I would use.
And it's great points. That the only other thing I would say is I think it's going to be very interesting. There's been a lot of news lately in the diabetes space about Dexcom, Abbott, Insulet partnering with Weight Watchers, partnering with health apps that are not going to be medically approved devices. But as they start to inform kind of decision making, and it's really curious to kind of see how those combinations are going to work out.
No, please go ahead.
I'll just be very short. Maybe a blunt comment, and now from a perspective of a physician only, no entrepreneurial perspective here. I think in the end, the success of a digital therapeutics or a digital health application, whatever, in the end, it needs to work at the primary care office of a physician, and it has to be very clear to the patient and the physician who will prescribe it what the benefit is, and that really needs to be real. And I really mean it in the way that it's fine to have FDA clearance and everything, but insurance don't pay. So there's probably a reason why insurance don't pay, and because again, oftentimes the problem the app or therapeutics is claiming is not solved to that granularity, which is required, which is hard, but it's in the end. The things, which are real, they have to work. They have to solve a problem in the doctor's office. And if they don't, then they're out.
A lot of thoughts. So I think it is incredibly important to differentiate between digital therapeutics and digital health, right? So those can be wildly separate things. But you still have the problem that the digital health app has to do something relevant. There has to be enough stickiness to it so that it has the chance of making a demonstrable impact clinically. And so one of the things that we with German Accelerator deal with a lot is, first of all, clarifying the nomenclature. Oh, I've got a digital, therapeutic. I'm like, yeah, is it really therapeutic, or is it like it helps?
Are you sure you want to be a therapeutic?
Yeah, you sure you want to say that? What data do you have? What claims are you going to make? And then we typically see a pathway to have these apps go with a direct-to-consumer model first to make sure that at the end of the day, even if you're eventually going to be a B2B, if the patients don't use it and you don't really understand the stickiness of the app, that is significantly problematic. Last comment I'll make is, in a way, I line up with you about DIGA and DIPA, sort of, and my little take on it is it's great, love it, no offense, but it can scaffold and protect apps that don't really solve problems and delay the inevitable death of these companies, right?
We had that in the past. Just recently, one Adipositas app that was there for 12. Maybe first I explain shortly the DIGA principle.
I was just about to say, we're going to move into, this is perfect. We're going to move into reimbursement. Let's talk about this.
Okay, it's basically for digital applications, healthcare applications that work standalone without a physician. That's kind of the definition, and is a class 1 or 2A medical product according to the European medical device regulation. So that's a bit similar to class 1 or 2 FDA low risk class. Then you can apply for a fast track evaluation and health technology assessment, where you get reimbursement from the first day it's approved. You have to prove a clinical study that you discuss not with a notified body in the normal regulation path, but it's directly with the authorities. You conduct the study, and then you get reimbursement. And it can go up to about 600 per quarter for the subscription that a medical doctor then subscribes the digital application to the patient. Now,
This
after
is
this,
just a digital health application.
this is
for
just a
digital health.
standalone. The major component is the digital health application that either supports therapy
Okay.
or supports diagnosis. You need a kind of a diagnosis before to subscribe it. A lot of them are in adipositas, in mental health. We have a lot of them. There are about roughly 100 available already. And now we had one bankruptcy because after this 12 months, with the assessment, the real value is calculated. And it's not immediately you get the result that it's a lower value. So about 6 months later, they got that it's instead of the 600, it's 200, 300. I don't know the exact numbers, so don't ask me for the numbers. I can research that. And then they had to pay back the money. They charged too much for the subscriptions in between. And this was the number 3 digital health application in Germany from the download rates, and that kind of killed them because it lowered the price. It was not for the first 12 months. It was for the duration between this fast track and afterwards. Well, I think still it's a great idea. It takes a bit risk out of the VC market, because for me, it's not only support of the application, it's also kind of an early investment of the market before you really prove everything. And kind of the healthcare system invests in innovation. And that's why I find it an extremely interesting political concept to introduce that, because the healthcare system is investing in innovation through that. And I think that's a good part of it. But it's not a solution for all applications. So it's not the holy grail. I gave the example today also. So if it's not looking for the gold nuggets in Germany now, or do the gold rush in Germany, rather try to build some shuffles and detection tools where the nuggets are. I think you're more successful than building up that. But maybe highlighting one thing I had when you explained, I also would always look which other products, also with digital products, you definitely other product solutions will disappear or will lose when you bring in a new solution, right? You have some losers in the system that kind of the market shifts. You have to understand them. It's not a competition. It's who you damage, who has an existing business model, and you might damage with your innovation. Kodak. You remember Kodak? So they also missed kind of moving to the digital market. Someone else killed then this business model, not in healthcare. And the second is look also, who do you promote with your solution? You promote one of the big ones, pharmaceutical product. I think in this area, you're very well connected to this. Do you promote this? Because this could be your natural partners or friends then later on in the stage, or strategic partnerships. And I think this, besides the own business model, that you really have a painkiller for a burning problem, you also should look at who you take off the market share or a product, or you cannibalize a product someone else has, and who you should partner with, because they also have a huge benefit from your solution becoming successful.
Thoughts, commentary, punches thrown? Anyone?
So I think that this is all true, but you find that the reimbursement systems and all of the issues which you're talking about are so different here from Europe that it is not easy. Insurance is a state-regulated entity, and they're all different. There's no federal law about insurance. Well, you have Veterans Administration, Medicare for older people. Our insurance goes with our job, and it's not following us. So when I change jobs, I change insurers, I change systems. Then the question is, who gains, who loses, and what are the incentives? And if you're trying to displace somebody that's making $25 billion in something, they're going to do everything they can to squish you, even if it's the best possible solution. It can be the most cost-effective thing you can think of. They have no incentive to do that. Insurance companies, they say, take 25% about of the dollars just to administer it. They don't really add any value to it, but they aren't going to move. They are the gatekeepers for the finances of who gets paid what amount. They want to be in the position of working with the drug companies and others. And I think some of the biggest lobbyists in the US are pharmaceutical sector, maybe the biggest. So they're owning Congress and Senate, et cetera. So it's very, very tough to come here. And that's the first thing. Second thing is things are big here. So CVS and Walgreens and big insurance companies, and they don't want to risk any part of their company on a startup. That they're happy to look at something, but it takes a lot to actually get into a channel partnership with them. And this drives companies crazy because you'll find companies, and then Mark and I have talked about this, German companies coming over and they have a pilot. And they're so happy they have the pilot. And the pilot goes on and on and on and on. The questions never end. They finally get to the point where everybody agrees they're going to do it, and that person leaves their job. Someone else comes in and they have no interest in this. So it's just, and it's just as tough for our companies as for ones coming from Germany, but it is much harder just to overlay the reimbursement because in the end, somebody has to pay for your solution, and you have to know who it is and how you're going to get them cost effectively.
How did you do it with Uvando?
Yeah.
No, you're good. Keep going. Rock on. I was going to ask a really random
I
question.
think, just amending to what Charlie said, I think one thing which is still, I feel oftentimes, undervalued is just looking at the balance sheet. Companies can't be profitable oftentimes at day one, and in biotech and pharma, it's very hard because you need a lot of upfront investment, to reach a point where you can earn money at all. I think in digital solutions, it's different. There's also kind of investment you need, but I think, having at the end of the day, revenue and a positive balance sheet, whenever that is, hopefully not too late, is very important, again, in validating basically, your problem statement and your value proposition. And for us, I'm not saying this is a good example or not, but we bootstrapped completely. And so, in my case, it was that in 2019, I was still working as a physician and scientist at Dana-Farber. I was here in the US. I had a co-founder and long-standing friend in Germany, and he is also a physician. And we just started the company, and we of course disclosed it to everyone and said, let's take 25,000 euros. That's what you need to build a GmbH. We had that kind of on the account, but couldn't do like much more. And let's close it down in a year if we don't have any traction, if you don't have one paying customer, right? So I think kind of echoing what also Marc and Joerg said is. At the end of the day, it's not about the dollars, but what is important is you have to, connect the problem with someone who pays, and finding that out very early and failing fast. So we would have closed the company down after 1 year, and I would not have thought to raising money, because raising money would not have helped me in order to understand whether someone would pay, and building an MVP, which still is an MVP, but kind of still works and does something and provides value to the patient, but also to the one who pays for it in this triangle of the healthcare system, that which Marc explained already. So I think that is, I'm kind of grateful that we never had to raise, because I think even working with a more lean budget, with less resources, it helps you to be even more focused on, on really the kind of customer and patient centricity in our case, and really trying to solve a problem as best as possible. So, so that's kind of my 2 cents I can share about that.
But come on, Mridul, it's sexy and nice to put on the skinny jeans, don the black T-shirt, and go talk to VCs and talk to Charlie all day, right?
I would love to talk to Charlie, but
He already smiles a lot more than most VCs I know. So.
Yeah, but honestly, I if I had to pitch in front of a VC, I would be in trouble because I've never done it.
Although I must say that one thing that VCs can do is to help you across the board, because they know the channels, they know good CEOs, they know the head of the pharmaceutical companies, because their job is to make that once they decide to invest, you're going to be married until the exit. So they're highly incentivized. That said, 50% of VCs are replaced within the first year after you get money from. And that's a
50%
joke.
of CEOs.
CEOs, sorry.
CEOs.
So that they basically are a bit shocked. They're saying, but it's my baby. And they're saying, no, you did it to here, but you can't take it up to there.
Yeah.
So you get a very different model when you take money from VCs because suddenly you're on an exit path from day one. They're not doing this because they want to be in there for 100 years. They're doing it because they have a fund, they have to get a return, they have to get a multiple, and you're part of a portfolio that they have, and they're going to figure out of all the companies they have where they're going to put their assets. So there can be value there because they can take you through this deep forest of personal connections that are impossible to figure out. I think it's very hard.
No,
Yeah.
Absolutely.
Yeah, or do nine.
Internationally valid. Internationally valid.
Yeah, I think, I fully agree. In most of the times, it's kind of inevitable to not work with VC because also they provide not only money, but also really value if it's a good VC and, and help you because they're in the same boat, they want you to be successful so that they're also successful, right? So, I would still say, so we are kind of in this impact type of world, and in the sense that I think for us as founders, it was still very important to really solve this problem, and maybe at a later stage take money in a growth stage and so on. But I think it gives you a lot of leg room if you can, to avoid taking capital early on or taking non-dilutive grants or things like that, which have less, I would say, interference. You could also say it's kind of, fuel or it's supportive, but also interference and allowing you to basically also do your thing. That is not always good because there's no correction, right? So it's basically you yourself kind of driving against the wall. I think, for us, the up to now, I think it was luck that we didn't have to take money and could kind of grow. We are still a small company, 29 people only, but we were able to pay the bills, just from the revenue we are making, and it's important to kind of keep the company also on track on the track we feel is the right one. Yeah.
Just a short comment. I think even if you take VC money investment, it's not, the team shouldn't celebrate when the closing is there of the investment, but should celebrate when the first product is in the space, when the first paying customer purchases something, or when the first license deal was a partner is signed and putting the first tranche of the milestone payment on the account. I think that's also something that I at least experienced in my scene, that you more celebrate kind of, we have 500,000, 3 million Series A round, the second closing, another 5 million. That's great, we did it, but it's not, the proof is that your product is in the market space, solves a problem, and you have a paying customer or a paying license agreement to your product. So I think that model is smart to lean, but also when you go for the VC, you have to create value and the paying customer and listen to the market.
Jürgen, and also just to add to that, so everyone does get very happy if you close around with the VC for lots of reasons. Everyone has the champagne or coffee or whatever, but the clock is ticking. But the clock is ticking for them too, and they expect that CEO is going to figure this out. And they have so much time to get to market and prove the case and set up the channel partnerships and all, or they're out. So I think that they're happy, but you realize that it's now a team, and you no longer really direct that team. It's a partnership, and you have a board, and the board here are very powerful, so they can throw the CEO out at any time. So it's really, think very carefully about that. People want to get the money, and they make the mistake of coming hat in hand and begging. Totally wrong way to do it. And in fact, most people, I think, don't know how to approach the VCs or even why, except they are desperate for money, but not realizing there's a whole process that goes on. You have to make sure that you want to marry this person or this organization and this group, and that they can add value, not immediately, but down the pike, and how can they grow, and where's the exit coming. So I think that the companies have to be very hard on the VCs too.
I agree. I'm just gonna say from my perspective, not having had to approach VCs for myself, but for startups, it's the hardest, most complicated, unknown marriage you ever get into, and it feels like the altar is constantly moving, right? Because what you thought was a marriage potential one day is 2 weeks later, oh, the market shifted. We don't actually think this is a great idea anymore. And it can happen that quickly, especially with something like Pear or Achille or anything else kind of going under or struggling. All of a sudden, you had 4 or 5 VCs that thought this was a hot marriage potential saying, no, not so much, maybe go rethink what you're doing. So I appreciate anytime anyone gives clarity on any of that, I think it is so beneficial for startups. Is there like one tip like that you would give when approaching a VC? Like if you could nail it down to just one thing, do or don't do. I know it's not on our list, but anybody got those kind of feedback?
I would just say, do your homework. Is that most don't do their homework. They don't know what funds are investing, where they are in the cycle of their investing, who the partners are that are interested in what they're doing, what their portfolio companies are. They haven't contacted the portfolio. They have no idea how it is to work at that VC. Do they have enough? Have they had good exits? What kind of exits, what kind of multiples have they had? How easy is it to work with them? Are they Frankensteins or are they people that really want to help build the company? They don't do their homework. And I'm just always shocked because people are so desperate. I had one German company and they asked me for help because I wanted to contact some VCs. And I said, sure. Do you have a list? And they gave me a list of 60 they'd already contacted. I said, you've poisoned the well. That you've got probably the top 10 out of the 60 were the best. And then they sent it to everybody else. And they got negative feedback and they never changed their model. They didn't learn, they didn't do their homework, and now they're impossible to fund. So that's the one thing I would say is do your homework on the VC.
Can I ask two then follow-up question for my startups in the audience? When you say do your homework, are you talking about get on the website? You said contacting former or current investments. What are the kind of ways other than, because I mean, again, I spend a lot of time researching on the internet, trying to understand investment portfolios, trying to look at past clients.
VC is a network business.
What do you do? Okay.
You have to network yourself in, and if you can't figure it out, you're toast. It's a network business. So talk with companies that have exited with them. Ask for a referral. Use LinkedIn. You need to get referred because people, I get hit every day by tens of people. They don't know who I am. Dear blank. It goes right into the rubbish. I didn't even read it. And you need to work that. Second thing, just as a subset of the first part. So it's one answer to 2 parts.
I don't think that's allowed. She said only
All right.
I said if you could do one, I'll take 1A and 1B.
Is that it's a long-term thing. Is that you need to develop over a period of time. It's not like a one-off, you meet somebody. The first time you meet somebody, it's for the second meeting. The second meeting is for the third meeting. You need to have a discussion over a period of time because they're getting to know you and you them.
Any other thoughts?
yes. Have a strong investment thesis, not a case for a good business. Good business means to an end, but Charlie invests because that company is a good investment, meaning lump sum in, 8x lump sum out. Right? Ish, 5, 8. But a good business is interesting, not sufficient for an investment.
And as part of that, Mark, it's companies, not concepts. So VCs invest in companies. A lot of people sell concepts, especially in the science area. And especially German scientists sell data. And so you look at their pitch deck and it's footnotes. It's like a science article. And you say, but where's the business here? Oh, well, that's on page 99. So anyway, yes, I agree.
I might add one. Let's just be authentic. I think that also described what you described. It's a long period. You have to discuss first meeting, second meeting. And if you're not authentic, if you have different things, someone will detect it in the process and you fall off it. You never get back through that door. That also means with the preparation, and it also means be authentic. It should fit to your situation. What you explained before, you should be ready to step back in a more maybe scientific position of that venture or in a non-operative position once you do that step. And if you don't want to do that,
rather grow intrinsically or without the VC money. And that's what being authentic means, I think, in approach.
Yeah, that's perfect. I mean, I said I can't give advice about VC, so I will maybe, just slightly switch it to something, because I've advised VCs on like due diligences and in the oncology space. And what I felt or what I've learned from this is, it kind of resonates also with me in terms of homework. So be prepared, and I mean it in the sense that, if you know whom you are talking to, do as much as research about not only the company, but also the person you are talking to, because, it's a people's network business. It also demands emotional intelligence. So you need to anticipate, before you talk to them, what is actually their interest. You should know your interest, ideally, you should be clear about that. And that's actually also not easy, but really, you need to have a clear mind going into any conversation, be it the first, second, third, fifth, seventh, eighth, or whatever. What is actually their goal and who is that person? Even in the science area, VC people have a PhD oftentimes, look up what they did research on, look up where they went to medical school or where they graduated from, what was their thesis, where did they publish, were they first author, last author, kind of things which are actually often unrelated to maybe, their VC role right now. But in the end, because this rigor will in the end also increases the chance to translate, essentially also in a relationship. And so that's something, I try to encompass that also for myself. When I talk to, new customers, I try to be very, very, kind of hard on, preparing myself before I go into, I take it very seriously, actually. So maybe, too seriously, but it's something, I feel is important. So that's kind of my 2 cents about maybe not only VC, but in general, doing your homework.
So this is really this theme about doing your homework. So when I work with Marc on some companies and he'll say, could you help this company? And I'll say, sure. I do my homework and I look at PitchBook and Crunchbase and all of this. And when I go in, I expect them to know that there are 5 companies that just got VC funding ranging from 20 million to 300 million. That's your competition. What's your edge there? And if they don't even know there's competition there, they're way underwater. So they have to know the people, they have to know the industry, and this data is available, you have to sort of dig. But that tells you, and I love it when they push back on me and they'll say, well, have you read this article? Or that's not my experience, or I talk with these other people. Or they ask me, so what have I done in that space? Or what companies have I helped? What value can I bring to it? So it's really a two-way street at the individual level and at the fund. But it's individual partners that make the deals. They sell it to their other partners, but you need to have at least one partner on board. So this is to your point. Yeah.
Okay, so we have about 10 minutes left. We could talk about all things data, or if anyone has questions from the audience, we could do that, because data is probably going to keep you from getting a drink at any time soon, because it could be an hour-long conversation. But any questions from the audience before we jump into data? Oh, good, we've got some. Okay.
Hi, thank you so much for your speech. You really got the wheels turning for me about how digital health is going to be impacted with value-based care. We were talking about how difficult it is to get insurance to reimburse you. What about consumer reimbursement? Is there going to come a time where consumer reimbursement is more valuable than having insurance? And is there hope for that? What do you think?
Ask a clarifying question. When you say consumer reimbursement, what do you mean sort of specific?
So, like, for example, if you had your insurance right now, you need them to cover your app, but instead there could be a subscription model, and instead of us focusing on getting our insurance reimbursement, instead of us focusing on FDA approval, should we be focusing on what is the best product that will get consumer adoption? And I think a lot of times with medical care, we don't focus on that so much.
I'm instantly kind of a little bit pessimistic about, that a consumer in this healthcare triangle, will pay for a service, let's say service, therapeutics, whatever, because, the willingness to pay in healthcare is low in general. as an individual. And there are different systems, US and Germany. In the US, you have more co-pay and things like that than in Germany or Europe. But I don't see this kind of, for really, therapeutic approaches as something which kind of is promising to myself.
Might not be for the mass market or for everyone, but for the one who can afford. Now, the question is if that's the model. That's how I understand it, because then it would be limited to a segment. Now I have to bridge that.
Saved by the bell.
So I would say the only thing that gives me hope in that space is the inclination that I've seen from standard medical device companies to start appreciating the consumer as someone who can make decisions. It's kind of a shift I think we've seen over the last 2 years. I mean, it was the Super Bowl 2 years ago where Hologic's doing Mary J. Blige ads, right? And she's their spokesperson for breast. Now, does that mean that every person can walk into a hospital and say, I want this brand of mammography machine? No.
Not in Germany. That's we don't have this delta payer in the healthcare market solution really established. So that's also then regionally we have to see how you can cover that.
Yeah.
But in US it could be a business model. Sorry.
No. It's just the only thing that makes me think that there might be some push towards it in the future is that the consumer is being tasked now with knowing more about their own healthcare. Correct. So that's the only thing, but that's an optimistic side.
So I think there is a trend towards consumerization of medicine, right? But does anybody know the percentage of healthcare spend in insurance that is in sort of value-based versus fee-for-service? If you had to guess, there's going to be a test later. Like 5%, around 8. Right. So we talk big, but it's tough, man. It's tough. I mean, MGB, right, is still predominantly a fee-for-service organization.
Yeah.
And so, I mean, I'll say this sort of, somewhat cynically. I think we task these poor guys in oncology and chronic disease with all this stuff because we don't tax McDonald's and Pepsi and all this crap that we eat that induces the chronic disease that we spend so much of our healthcare. So I'm hoping that prevention is actually where the consumerization comes in and where those incentives are actually rewarded. I don't know if that's going to happen.
But can businesses change that, or is it a governmental
So-
and legal framework that needs to change that? Sorry for
I mean, so one thing I would just add is that this country has a system that's broken, and we pay more than anybody else 3 or 4 times at least. We have the worst health statistics of anybody. We die younger, we're fatter, and blah, blah, blah. And so you end up, if people can pay for something, I have excellent insurance, and I have enough money to pay for whatever I want, so I can afford that, but a poor person can't. And so they tend to be more not eating properly, not educated on fats, proteins, carbohydrates. No access, they have to make trade-offs of medicine, breaking a pill, and having to pay the rent, taking the kids to school. We have a very class-driven society here, and I think we gloss over that too much. If you're very poor, Medicaid, but you have to be really poor, they drive people into poverty. And then if you're the middle class, it's just above that, until making a fair amount of money, it's still very tough. And if you're in the professional services and like around here in the East and West Coast, this is like the golden age here. But if you fall anywhere in that middle, it's very tough. And so you will have business models to go after people that can afford it, like concierge medicine here. You can afford the doctor comes to your house, and the average person can't go even to the hospital, or they go to the hospital. The most expensive way to get a Band-Aid is to go to the hospital. That's all they can do. So it raises the whole issue about the class structure of our society.
And we have a couple more questions. I want to get at least one more in. You had your hand in the back for a while.
Kind of hear all your different perspectives, but I'm curious about the investment thesis model that you're talking. When like someone's coming, talking about the investment thesis model that you mentioned, like when a company is coming to you, you're not just investing in one thing, but you're investing in the investment. So how does a company show its value proposition if when you're making a company, you're told like focus on one product and be good at one thing, but then you're also saying you need to show this investment thesis. So can you talk more about that?
So I think that basically we're trying to summarize in one statement a whole process. It's tough to do. It's almost like saying, what do you do from dating to marriage? Well, it's not one thing, hopefully. And it's a process that goes along there that you don't even get to the point of saying what's the product going to be and how you're going to move that ahead unless you already have a good personal relationship. And people are building that. So you have a lot of informal discussions that have nothing to do with the business at all. Want to know about your family, if you have kids, what have you done, have you traveled? What do you bring to the table? What kind of mindset do you have? What kind of problems have you solved? So I think that that is a later stage discussion. And by the time you get to there, hopefully you have a good relationship with the person and that you are also asking them questions to make sure that they can help you because you should know it better than they do. You're the CEO, right? So when I invest in a CEO, I know there are going to be problems. I am betting you're going to figure it out. And that's what I am betting on because I'm not going to be running all these companies. I'm going to be helping where I can, but you're the CEO. So I think that you have a relationship over time. And then these things have to naturally shake out. You get to the point and you feel like this isn't helping me and you just drop them.
Right, I know we're probably keeping everybody for the beer tasting, but if there's one more quick one, we have 2 minutes.
So whenever I'm looking at a digital health company, it's not the technology, it's adoption and resources in this country. See a sign right there that says Invest in Bavaria. What's the environment like in Bavaria? Is it more hope over there?
Great question. What a
Huh, I think I should answer that.
Let's go to the leader motion.
I thought already this panel is going a bit pessimistic about you should not innovate in that space and go home and go back to university.
We've been smiling the
research.
whole time with
But I think we're all optimists here on the panel and would encourage you to do it. First, a general comment not about Bavaria is it's not about how often you fall, it's about how often you stand up again and continue to walk. And that makes you successful at the end of the day. That's not a statement from myself. It's I think I stole it from somewhere. I don't know where from. I think we also have challenges in the healthcare system. You always look remotely to other healthcare systems and you think it's much easier there than it is in our home situation. We have a lot of, and now I first describe the challenges and then I give you some hope. But I think you also have to give US hope for digital models. That's then your job. We have a huge challenge on data protection and data security that might be even above what you have here. Normally we face it, the positive of us face it, if it works in Germany, you can scale it to everywhere from the data security protection layer, not from the business model layer. There are also some things on the reimbursement that it also takes time to do that. There are also some things that are not based on value, but based on procedures in the hospital. And that all makes it very hard for evidence-based, data-based products, which most of the digital products go in a direction of building up either optimizing processes in the entire healthcare space, or it's based on evidence, and evidence is based on bringing quality into the healthcare system. And I think that should be also your motivation to stand up again when you fall with your first model or the second model, because you bring quality to the healthcare system and all of that. And I think that's a shared thing that we have all on the panel here. We have in some certain spaces, we have this with this digitale Versorgungsgesetz, so digital care law, and we have Gesundheitsdatennutzungsgesetz.
Say that 10 times fast.
I promised you that I will teach everyone on the panel this one. Gesundheitsdatennutzungsgesetz. It's actually, the best is the name of it. Before we had data protection laws, now we have a health data usage law. So it actually enforces everyone to use health data. And that's great for the healthcare system. Now, if you look at the details, there are also a lot of limitations and the framework makes it so you have to, the law is good. It has regulations like everyone has a central or has a opt out to have a digital patient record. Well, you still can opt out and then you just don't get good healthcare services. But then you suddenly have data put together and you can create models on top of that, right? And then quality comes into the system, into the healthcare system, and that's what contributes then to the solution. Now, I think we have a few other things that might work better in US, especially if it goes to the amount of investment and also the speed you can drive models forward. I'm always jealous of US, and you also explained that now in the panel a bit. But we can, I think this building up on digital applications, there are good chances in near future to have a lot of models that will work in combination with this DIGA reimbursement.
Thank you all. You're wonderful. I see us getting kind of like a little poked, so I think
Well,
we're
the other thing is because he's wearing lederhosen and he can talk forever.
good.
Give me a beer and I talk even longer.
I know. I love it. I'm so happy that he wore the lederhosen. So thank you, everybody. And thank you guys. There were 4 points that these guys said about how to reach investors because it is an investors conference. Mark said, have a strong investment story, not just a good business. Charlie said, do your homework and network, get a referral. Joerg said, be authentic. Mridul said, be prepared. I really like this one, Mridul. Be prepared about the person you are talking to, emotional intelligence. Look up what they did, look up what they studied, anything you can find about them that kind of tweak their, get them interested in you. So thank you very much.